Morning, everyone. Dr. Eric, the fitness physician, where I talk about all things related to hormonal fitness, muscle medicine, and much, much more. So I've been doing another little mini series based on a journal article that I came across. And I know a few other people have talked about this as well. It's an interesting article. I had to do with the metabolic changes in aging humans. In other words, as we age, what happens to our body composition, what happens to our metabolism, and how are they connected, right? So a lot of this has been studied and known about for a long time. You know, basically body fat and metabolism and aging has been intricately linked, and we've known this, and there have been many theories that have gone back and forth. So this has to do with what happens, especially as we get less active and don't eat right, right? Usually lifestyle as we get older. Obviously it's important in any part of our life, but as we get older, even more important. That's why I talk about the importance of the muscle, keeping it strong, building our bodies up to keep our metabolism humming along. If we don't eat, we don't strength train, if we stop moving, basically we get sarcopenia and our muscles start to disappear, and then as well as our fat mass starts to increase. And then by losing more muscle, we're gonna increase fat mass even more. There's gonna be an inflammatory process that's going on, and it's gonna actually snowball in a very vicious cycle and cause further loss of metabolically active tissue, gain of the fat tissue that we don't want, and which is going to affect all of our organ systems, which is why if you don't do the right things as you get older, you're going to get weak, frail, tired, fatigued, you know, and just look bad, feel bad, not be able to function. That's what we don't want. That's what I'm all about here at Primax. So I did the first episode last time, so check that out. But basically, as we age, a lot of studies have indicated we get an increasing in central fat too, that the dangerous visceral fat that we don't want around the abdomen, and the deep fat, that's the very dangerous kind that can cause inflammation and lead to other inflammatory processes, diabetes, metabolic syndrome, high blood pressure, and so much more. And of course it accumulates with men and women. Women, in general, at least early on, tend to have it more in the upper body and then the lower body, whereas men tend to accumulate more in the visceral section and again, a little bit more upper than lower. Now, in menopause, this can change because, as you know, with menopause, women get a pretty significant drop in all the hormones, but definitely estrogen, which contributes to body fat distribution. I'll talk about more of this in another video, but how estrogen affects the body. In general, it's anti-fat. It breaks down fat, right? That's all why we want to optimize our estradiol levels. But it does contribute to the distribution of the fat. That's why women tend, especially in the younger, tend to have that nice hourglass shape, right? Tend to accumulate more in the hips, thighs and buttocks, have that curvy shape because that's more conducive to childbearing and a healthy fat distribution. As women age and go through menopause, this reverses, and then they tend to get more like what we call with men, tend to get it more in the central area in the visceral section, which is what you don't want. So this is how it tends to accumulate in general, but as menopause drops, this can change. With menopause, again, you get more of a lower distribution compared to upper in normal cycle. But again, as women go through menopause, this can change. This can change when estrogen drops in menopause, you get an increase in change in lipolysis, which I'll explain in a minute. So as most men and women get older, there's a change in our fat metabolism, right? In general, there's a less of a fat storage and more meal fat oxidation. In other words, the food that we eat are oxidized. You would think that would be a good thing, but again, it depends on your activity level, how you're eating, and so many other things. Because in general, what this means is that there's more free fatty acids floating around the system. But what can happen is you can get ectopic fat distribution. It's floating around looking for a home. And if we can't store it in our subcutaneous fat, which is what I meant here, fat storage in subcutaneous fat, everywhere throughout the body, that's actually a good thing because it tends to be a different type of fat. Whereas when it's stored in the organs or in the viscera, it's a different kind of fat. It tends to be a bigger fat molecule, and it tends to get a little pissed off, right? It gets angry, starts secreting these inflammatory cytokines, or basically these enzymes that can cause further inflammation and affect not only other fat cells, but other parts of the body. And again, I'll get into this later. But the bottom line is, as this happens as we age, we get more free fatty acids floating around. So right, when we're younger, fat storage, again, tends to be more predominantly in the upper section of our body compared to the lower, right? But this can, and with men, for example, this can be reversed, as we get older with the changes in testosterone, right? So again, this is why as men get older, tend to see, this is the questions that came up that start all this. Why do we get this change in our body shape, right? This is why men tend to get that beer belly, that gut, because of increasing visceral fat accumulation. And then again, this can be reversed typically with optimizing their testosterone and with estradiol. Same with women. Again, typically they tend to accumulate lower, but that can switch if they're not optimized metabolically, right? So again, this is why testosterone and estradiol are both very important for reversing this and preventing that accumulation of that dangerous visceral fat, right? So, and then we'll talk about more in aging fat, which I was just alluding to with the inflammation, right? As fat gets older, and especially if it gets inflamed, you get decreased proliferation, right? In general, fat cells can multiply, what's called hyperplasia, versus just getting big, which is called hypertrophy, right? Now you'd think hyperplasia would be a bad thing, more fat cells. Well, of course we want as little as possible, right? But in general, if you're taking in food as you're growing, it's actually better because then again, it'll be more spread out, they're smaller, they're not secreting these inflammatory cytokines, right? They tend to accumulate all throughout the body evenly. Whereas when this reverses, basically the fat cell just gets bigger and bigger and bigger. And that's the bad kind because then it gets inflamed and causes these other processes. So with aging fat, you get decreased proliferation. Again, you get decrease in lipids in that, in general, which is why, again, they get big, and then you get to a point and you get spilling out, right? That's where you get this increase in free fatty acids. They can only fill so much and they start spurting them out. Nope, don't come here, go somewhere else. It's going to float around and it's going to go where it's not supposed to be. That fat's going to go into your pancreas, cause insulin resistance, and diabetes is going to go into your liver, cause fatty liver, pre-diabetes, metabolic. It's going to go all around your organs and other parts of the body and wreak havoc. So also with aging fat, there's more oxidative stress and there's increased senescence. We've talked a lot about senescent cells, these angry cells, these zombie cells that kind of float around and just, again, cause inflammation, cause damage, and then that wreaks havoc. And we all know that inflammation, oxidative stress, these are the two of the biggest causes of aging, right? This is why, as with the aging process, you get, osteoporosis and visceral fat, and inflammation, creaky joints, high blood pressure, diabetes, all these conditions because of these two. And this is what we don't want with aging fat. We want to reverse this. We want our fat young and healthy. We don't want them growing big and getting enlarged and getting inflamed and getting pissed off, right? So I'm going to continue this in the next one. So it could be a little, I don't want to get too overly complicated, but basically this is the bottom line, is that in general, especially when we're younger, we tend to accumulate fat more in the upper body. And then, when we burn fat, it tends to be released pretty much easier from the upper body, right? With women, same thing, but upper more than lower. And again, as if there is some fat accumulation, especially with pregnancy, etc., it tends to be more lower. But again, with menopause, estradiol drops, and this can change, right? And then you tend to get more in the central area and the visceral area. Men, as they get older, because of the drop in testosterone and estradiol, again, accumulating here in the midsection and the visceral fat. And that's what we want to reverse with proper lifestyle, proper diet, exercise, and of course, hormone optimization when indicated. So, and then again, we want to prevent fat from getting angry, right? We don't want angry, pissed off zombie cells floating around. So anyway, so hopefully that makes some sense. If you have any questions, please like and can share this post, drop them in the comment section below, and tune in for the next one. I'm going to continue down this. I'm going to explain the aging fat and what we can do about it. So everyone have a rocking day, and we'll talk to you soon. Bye.